Welcome back, everybody, to your weekly Wallace update. Today is Friday, September 11th. Today, I'm joined by Mrs. Shannon Matteson, who is our school nurse. How you doing, Shannon?
Good.
All right, so today I thought we'd take just a minute. Not a ton of stuff going on at school right now with everything. So I thought we'd take a minute just to, check in with our health and safety protocols, how things are going, talk about some of that new guidance that we have received from the Illinois Department of Public Health. So first of all, and chime in whenever you'd like, Mrs. Matteson, but we did receive this document just yesterday. It's actually a two-page document. Sorry, I don't have it printed in color. But this is a new exclusion guidance document, correct, that outlines basically what needs to happen if a child or staff member, student or staff member is symptomatic, right, or exposed.
Yes. Yep.
So really, I think for the most part, a lot of the guidance stayed very similar in this document. There is some more wording that just gets a little more specific. Wouldn't you agree?
Yeah, it looks like, so what they did was add the word new to some of the symptoms just to kind of exclude those that have chronic conditions. So, for example, headache, if it's, a kiddo that has chronic migraines or a chronic headache, they have added the new onset. So also as well, abdominal pain has changed and it says from unknown cause. Okay. So we do have some students that have chronic conditions, and I would encourage parents that if you do have a student with a chronic condition, to make sure that you're reaching out to me so I know about your students and if it's something new that happened over the summer as well. So
you've got mail.
I just want you to reach out so I kind of know that that's something new to them.
Sure.
The other thing that looks like the columns are really basically the same. So if you do have a kiddo, and I am still encouraging you to check their symptoms every morning, kind of go through the list, make sure they're feeling okay. We want to have a healthy building. So if we do have a kiddo that has symptoms, it does still stand that the siblings or household members would still stay home until we kind of figure out what's going on. Right. That's the biggest changes. Page 2 is really more for me. And it's just some thinking points for school nurses and healthcare providers, mainly looking at if that student or staff member has had an exposure or a potential exposure to COVID-19, to make sure that we're taking that into consideration, because that would be a little bit more of a heightened situation. So it's important for you to let me know if we've had an exposure, just so we can keep a close eye on your student. And if they were to have symptoms, we can go from there. So.
Yeah. And I think you've done a really good job in terms of working to manage these protocols and working with our parents and families to make sure we're adhering to these guidelines. Now, here's something I think I know we've had several questions about. So it talks about household members, if anyone is symptomatic. The same thing would apply, like, for example, if there's someone in the household that's not a student, the same protocol would apply, correct? So if,
correct.
For example, one of the parents had symptoms, then that would automatically trigger those kids would technically need to stay home as well. Is that correct?
Correct. So hate to tell you, but if you're sick and have COVID-like symptoms, you have to keep your kids home with you, which is a little bit of an inconvenience if you're not feeling well. But until it's figured out by the doctor, we really need you to just kind of keep the whole household home. Yeah. So we can keep that healthy building going. We are going into flu season, influenza season. So it's real important for us to try and keep that everyone as healthy as we can. So.
And I think these protocols, I think, are definitely very strict in regards to they can really cause a lot of disruption for families. Obviously, anytime a family, if they have to stay home for 10 days or whatever it might be, it's going to cause a big disruption. However, if we're looking at it strictly from the health and safety end and aspect, of our school community, these are going to do a good job of, mitigating that spread of anything. So in that regard, it's going to be a good thing. But
Yeah, and it is, it's real important. There are 3 different ways that your student can return to school if they're sick. One is, first of all, I encourage you to contact their doctor. That's the first thing.
yeah,
And it might be something that's chronic. It might be something that they rule doesn't need a test.
yeah,
And they can provide us a note, and then your student, when they're feeling better, can come back.
sure.
It's not an automatic 10 days out of school. So, we've had kiddos that are sick and seen the doctor. The doctor has deemed them okay to return to school. They've looked at their guidelines, and then they've come back in 1 or 2 days later. So,
Yeah. And I think we've seen now a lot of notes from several of our local pediatricians, especially. So those doctors and their offices and nurses, they're getting pretty used to dealing with how to manage this stuff and these protocols from their end. So that's a good thing as well. I mean, I think overall, we send out our health and safety metrics, countywide and school-wide metrics, out to our community every Friday. And I know we've really been looking at that information week to week. And I will say the stuff that's being put out today looks the best that it has. I mean, we've been in school for 4 weeks, but it's the best week we've had so far.
Yeah. We've had a good week. Yeah.
Yeah. And percentage of overall students. So that's great. So we do appreciate, our parents and our community supporting us in those efforts, because ultimately it takes the support of everybody to help keep our community safe, not just what we can do inside these school walls, but in the community as a whole.
One thing sorry if I interrupted you, Mr. Landers, but I did want to reiterate that we do have an email called nurse@wallacegs.org. And that is an email that's managed with us in the office. And so if it's any kind of symptoms or you have questions about this, just email us. We're checking it often. We'll check it in the evenings. We'll check it on the weekends. So, email us and we'll get back to you with any questions that you have, or you can call in the morning, after 7:30 to the front office. So.
Yeah. And we do have several folks that manage that email address. And the reason being is so we can be replying to folks at night, in the evenings, early morning, or on the weekends. But if by chance you do not get a reply by 7:30 a.m. of the following school day, call the school office and we can assist you in that way. I guess the only other thing to just reiterate, symptom certification checks in the morning. I think you kind of touched on it, but
yeah,
we take care of temp checks either at the bus stop or at the school entrance. But it's really, really important that parents are taking, and I know it's tough in morning routines to try to do another thing, but really emphasizing and making sure you're thoroughly going through that symptom list and making sure those kiddos are symptom free.
Yeah, definitely. And it's really individualized on your student. Some students you wouldn't want to list those symptoms to them because they might have them all if you list them. So it's really individual on how you want to approach your child. Sometimes as a mom or a dad, you just know if they're a little off. And so that's when I would encourage to kind of dive into it a little further if they're seeming a little off for the day. So, I'm not saying you have to go through and list every symptom to them, because I don't want them to be in panic every morning with, these symptoms. So just kind of check in with your kiddos. If there's a grandma or grandpa getting them ready, encourage them to do the same. So we know that they're at their best when they come to school.
Definitely. And I know we don't want to continue to drive this stuff home week after week in our weekly updates, but I think it's really important to just make sure everybody is knowledgeable and understands what our guidelines and protocols look like, because, like you mentioned, cold and flu season is ahead of us. It could potentially be a really rocky road for us with these protocols with that. So we just got to do everything we can to keep our school community healthy. So, all right. So I will be emailing the new updated guidance document. Will come to parents with the weekly update email. It's also available on our website, so check that out. And there's tons of other information on our website, wallaceks.org. And as always, check us out on social media. We keep stuff up to date there. It's Facebook, Twitter and Instagram at Ottawa Wallace. So thank you, Mrs. Matteson, for joining us.
Thank you. Stay healthy.
All right. And thanks, everybody. Have a great week.